I'm Millie Keeve, and I just want to tell you about some of the people who've contacted me about adverse reactions to medicines, particularly psychiatric reactions. This week, a person contacted me who took a drug for high blood pressure called Losartan Potassium, and she believes her depression is being caused by this drug. Her doctor just dismisses her, and she's even told him she's felt suicidal. Well, I told her where to look for the information so that she can prove to her doctor the drug may cause it, because it is quite well known that cardiac drugs can cause depression. Anyway, I looked on a website, which is the Association of British Pharmaceutical Industries website. You just go to medicines.org.uk. You put in the name of the drug, and the summary of product characteristics, the SPC, comes up for different manufacturers, and it should tell you all the data that they had to produce when the drug was licensed. So not every side effect will be on there, and sometimes they say that things they don't know how many times this particular side effect happens. But if it's listed, then it has happened during the clinical trials. So I found, for example, under Merck, psychiatric disorders, insomnia, common. And then anxiety disorder, panic disorder, confusion, depression, abnormal dreams, sleep disorder, somnolence, memory impairment, uncommon. Now, how they know it's uncommon, we don't know, because very few doctors actually ever record or report side effects. So we have a yellow card system. Patients can report and you can report. Please do. In England or UK, you can report to yellowcard.gov.uk. You can phone up the MHRA, who's the regulator, and they license the drugs, and you can ask them to send you a form. There are patient reporting forms, but they're very poorly publicised. The doctor should report it, but if the doctor doesn't believe the drug is causing it, he won't. So you report it. You don't have to have evidence. The MHRA know that a lot of these reports are just linked to the drug, but obviously it's important they get the reports. Anyway, looking again on medicines.org.uk, I looked up another manufacturer, Actavis, and under their data, they said with this drug Losartan Potassium, which you may know under a different name, a trade name, a generic name. It says here, the frequency of adverse reactions identified from placebo-controlled clinical studies and post-marketing experience. So they've got it from studies. Psychiatric disorders, depression. And then it says frequency not known. So at least they do admit they don't know how often it happens, but it is a side effect. So this lady can at least go to her doctor and say, you know, it is a recorded side effect. She has actually stopped the drug and she does feel better. But obviously she's got to do something about her blood pressure. And one of the things you can do is reduce salt. I'm sure you know that. But that's the major cause of people's blood pressure going up. There can be other reasons, obviously, and you should always have this checked out. But the level for blood pressure and whether it's high has come down and down and down, which increases the amount of drugs given. And also when you go and first have your blood pressure taken, it will usually be high because you've gone to the doctor. It's called white coat syndrome. But I'm not here to give you medical advice because I'm not a doctor. I hope the information has been helpful, and please will you report any serious side effects, ones that affect you, stop you going to work, or affect your life in a detrimental way. Report to your regulator in your own country or in the UK to www.yellowcard.gov.uk. Thank you and farewell. I'll be seeing you again when I tell you about another drug that's affected somebody who has contacted April Charity. And the website is www.april.org.uk. Bye.